New Hampshire school districts are getting close to the end of the school year and sending kids off to summer vacation.
So with the upcoming time off, the U.S. Surgeon General recently issued an alert about the effects of social media and their use on mental health.
We are joined live now by Senior Medical Director of Mental Health, Dr. Fouad Khan from Wentworth Douglas Hospital. Dr. Khan, thank you for being with us today.
Yes, you're welcome. Thank you for having me.
Dr. Khan, let's get right into the questions here. The Surgeon General says a common question he gets is if social media is safe for kids. What is your answer?
Well, over the last several years that we've been watching what's happening, we would say from a mental health perspective that social media has influenced a lot of negative behaviors and outcomes, much more than we anticipated, and much more than what we can think of as benefits of the social media. So we are all very concerned as mental health professionals.
Doctor, kids that develop low self-esteem from social media, very concerning because it can be hard to break out of that mold and it can be something that lasts for years and years into adulthood. How can parents counterbalance what their children may be experiencing in terms of their social media identities?
Oh, that's a tough question because, in the current modern day and age, our influencing factors have broadened way more than just our parents. We think that parents hold the same level of influence as they should, but no, our media holds more influence now. Our media is with us more, and let's put it this way: our parents ourselves, we are parents, and us parents them ourselves are influenced by the media. We are failing to even model for our kids how to avoid being influenced by media. So it's a tough thing to do in this current modern day and age, to break or challenge the influence of media, which is so enticing, so attractive, and all the time present. So it's a difficult task. I think it starts with the idea that we need to first start modeling the behavior. How many of the parents themselves are addicted to the phones and other media is where we need to start, perhaps.
And we just reported, Dr. Khan, yesterday that Governor Chris Sununu signed an executive order calling for social media curriculum in New Hampshire schools. How could teaching kids about social media change the way it affects their behavior?
Well, I think this is the start. This is a start. So, like I sometimes say that a knife can be used to cut the vegetables, but it can injure your finger too. But if you don't know how to use the knife, you'll be likely to injure the finger. So I think this is the right approach. Let's take, instead of saying this is bad and remove it, I think this is the time to take interest in actually looking into it. How do we control it? How do we use it? How do we use it to our best advantage? And how do we protect people from overusing it and being exposed to the negative aspects of it? So I think bringing the curriculum in the schools is an excellent idea. I think there needs to be other things brought in as well, such as some very clear, deliberate ideas about how much it can be used. Are kids supposed to bring their own media to school and have it all the time? I think some rules and regulations have to be put in place on how to use it and how much to use it, even in schools, and it should be part of the curriculum.
Sure.
So I support that.
So limiting use and modeling for your kids the kind of behavior we want to see with social media. Great advice. Dr. Khan, Senior Medical Director of Mental Health at Wentworth Douglas Hospital, thank you for joining us this afternoon.
Sure, you're welcome.